Hello, this is Dan Williams, Elite Home Care. To my right is TJ, is what I call him because the rest of his name kind of makes me a miss on it. So, but a very, very charming gentleman, and he's also an MBA. He's working in a charity and caregiving for seniors now at Aricares, and he'll be our lead today, which is phenomenal. Gina, um, wonderful gal and super smart. They got a phenomenal program where she's working, and gosh, I'm just so happy at the Villa Rancho Bernardo. She, it's not just her. I mean, she not only it's her work, but she's got a whole department that she runs, and it's pretty phenomenal. And that's why we're tapping into those type of informations to bring you guys up to speed in what we can do, especially in fall prevention. TJ, you got any opening suggestions?
Oh yeah, thanks so much for that profound introduction, Mr. Dan. Welcome everyone again to this webinar. Like I said, my name is Olatunji Taylor, but for the sake of convenience, you can call me TJ. I'm the founder of Aricares Alliance, and I'm glad that you're joining us today. So we're talking about falls for proofing the home, and the practical safety strategies and equipment and support for seniors and caregivers. um, Generally, we know that falls on one of the most common reasons older adults lose confidence, they lose independence, and after even one incident, mostly, especially they may face emergency visits, long recovery periods, and growing fear about moving safely, at home. But the good news is that many falls can be prevented, and that's why we have Gina on board today. She's gonna, kind of educate us on that. And today's conversation is designed to help seniors, family, caregivers, and loved ones to better understand the practical steps that they can take to reduce fall risk at home. We'll talk about common home hazards, simple safety improvements, caregiver awareness, and how to respond after a fall. And of course, I believe that Gina will also be able to provide resources about the community support that are available for families. This is actually going to be a conversational webinar, no slides, no, it's just going to be you and us discussing the reality about falls. And I think that's all I can say right now. Gina, you want to introduce yourself, please?
Sure. My name is Gina Dallasay. I'm the Social Services Director at Villa Rancho Bernardo. Villa Rancho Bernardo is a skilled nursing facility. We're 299 beds. We take Medicare, we take HMO. We're also Medi-Cal certified. All our patients pretty much they come from the hospital to us for skilled nursing or rehab, and our goal is to rehabilitate them to either go home or back to the community to a lower level of care. And then we also have custodial care here as well.
Right. Thank you so much, Gina. Over to you, Dan.
She's humble, but really what happens for Gina is after the surgeries, after they've worked on patients for whatever time is needed to get them back to rehab, then they send it to Gina, and she's the one that dictates where and how they transition from a facility back home. And it's pretty phenomenal what they do. Can you just outline a little bit about what are the things that you're looking for when they talk to you about, okay, this person's done with the rehab, time to go home? What type of advice would you give them?
Sure. So our rehab department is heavily involved in the discharge planning since, if the main reason they're here is rehab, we want to make sure that they've checked off the boxes as far as wherever they're going is safe. For example, if it's home, how much support is available? Are they able to do stairs if there's at home? Um, and our rehab also does caregiver training with the family. Um, just to show them what we're doing and see how they can best be safe at home. Now, if there's any barriers to that, that's where we also come in and assist with home care or home health ordering durable medical equipment, and any other community resources, such as in-home supportive services, the CalAIM program, or if anyone's a veteran, some resources through the VA for home care. So we kind of look at the whole picture and see what we can recommend to ensure that it's, the safest possible discharge.
Okay.
Right.
And can you give us a scale of what people are looking at? Is it falls based on they slipped, or is it falls because they had a heart attack, or some type of mental collapse?
For falls, I would say it's mostly, I would say it's like half. Half is related to medical issues. The other half, they tripping over a dog is very common. Like stepping out of the car and they've tripped and fallen, or they've just tripped inside the home or somewhere out in the community is very common. So our rehab definitely works on, balancing, strengthening, endurance, and then they can also do fall recovery.
Right. So, but before we move further, I'm just curious, right? And there's been a lot of debates about falling and falling. But my first question would be that is it normal for seniors to fall?
Oh, I would say absolutely. And there's a common misconception that if somebody, goes to a nursing home or an assisted living, or if they're at home with even caregivers, they shouldn't be falling. But unfortunately, the reality is, it definitely still happens. So unless somebody's like one-on-one with you 24/7, falls are definitely common in the elderly. And although, we all try to prevent it in different ways, sometimes it's inevitable.
Is it normal? Well, if there is no underlying, issue or ailment, most likely they will not. Yeah, but then if the home is not safe, or if the environment where they're at is not safe, they might fall. You know what I
Yeah,
mean?
it could be environmental factors. And also, most elderly people aren't active as much. Some are more sedentary. And so you lose, strength and weakness and your activity tolerance. So that can contribute to falls as well.
Right. So from your perspective, so how does this affect the seniors' physical, emotional, and social, well-being? I mean,
Uh,
after a fall.
oh, I think it affects them tremendously because, they don't want to go to the hospital. Most of them don't want to be in a nursing home for rehab. And so, some people take it harder than others, but our goal is to try and rehabilitate them as much as possible and get them stronger before we discharge them back home.
Right. Mr. Dan, you want to add to that?
I just a kind of a separate ballpark. How many times does it happen where when like our greatest fear in my family is when if my dad fell and he was near my mom, because he would have reached out to her because they'd been married for 50 years and that's who he saw every day. So, but at the same time, he outweighed her by probably 70 or 80 pounds, and it would have pulled her down and she wouldn't have been able to get up either. Do you get much of that type of
Yes, like
thing?
do we
Well,
see
by the
that
time, as
situation?
caregivers, by the time we come on board, that's already happened. So
Exactly. Yeah, so like say if, for example, we have some residents going home and the family is going to be the one, the primary caregiver supporting them at home, our rehab department ensures that the family can handle the care, and that's something that I would review with them as well.
yeah, because that's a hard one because as family, you want to get in there and help.
Right.
At the same time, sometimes it's like, no, you're only 5 foot tall and you only weigh 110 pounds, and your husband weighs 200 pounds and he's 6 feet tall. So I would think that would make a big impact difference.
Yeah, so that will determine when either home care comes in, or sometimes we recommend assisted living or boarding cares instead, or long-term
Yeah.
care if
Okay.
just the family is not able to provide the physical lifting or assistance that's needed.
Okay. And
Yeah.
I noticed that you on your on one of your things you said you have an MBA. Is that on like social working, social services?
Oh, myself? No, I just have my
Yeah.
bachelor's in social work.
Oh, okay.
Yes.
Well, that's awesome.
But I've
you've
been
done
in the
it.
skilled nursing industry for 16 years now.
That's what I was going to say. In other words, then
Yeah.
you got it by being on site.
Yes.
So that's huge. Sorry,
Right. So,
TJ, did you have something?
oh yeah, I do. Yeah, I want to ask that what is a good starting point for preventing falls? I know that falls could be, I mean, adults could fall maybe due to, some underlying ailment, high blood pressure, stroke, and some other things, or injuries. But then let's look at the environmental factor or the home factor. What would be a good starting point to prevent falls at home?
Just from my experience with working with our rehab director here, I know he recommends taking away all throw rugs on the floor, any items that someone has access to or needs access to, get it on a level that's lower and easily accessible. For example, like pots and pans, plates, things in the kitchen. I know the shower is also a big thing. So depending on whether it's a tub shower or a walk-in shower, we can help order things like a shower chair, transfer shower bench, and then also recommend grab bars in certain areas of the bathroom to help prevent falls, and also by the toilet, doing grab bars by the toilet, or if it needs to be raised, we can order a raised toilet seat, or a 3-in-1 commode can go over the toilet as well.
Yeah, so you mean that someone has to go in the home and do some thorough assessment.
Exactly. Normally, when somebody discharges from a skilled nursing facility, we refer them to home health. The physical therapist or the occupational therapist can definitely make recommendations and do a home safety evaluation. And then there are just various general contractors and some organizations that will help with adaptive equipment in the home as well.
Thanks. Because in my experience, like Mr. Dan said, well, I've been a CNA caregiver. I mean, I've been all over the place. Yeah, but so I noticed that even some families, even though they've gone through this phase of assessment, because I know that, for example, Elite Home Care then also takes part, I mean, participates in some of these assessments, and they kind of work with people like you to and some physical therapists to give more recommendations. I noticed that families sometimes delay making those safety changes even when the risks are obvious. Mr. Dan, what do you think is the reason behind this?
Well, part of it is by the time they get discharged, their family members been to the hospital, they've been through rehab, and uh, now is a different, gosh, what would you call it? A different part of life, and they just don't realize what a little bit of a slip in a bathroom is. I mean,
Mhm.
it takes that, if hearing it several times. The hard part about bathrooms too is they're small. So sometimes somebody can fall and they can get stuck between the commode and the shower. And
Mhm.
now you got it's just tough to know which way to go. And then who is it? Like at my house, with my family, my brother went to take care of my dad, to help as well because mom couldn't get him in and out of the bathroom, let
Mm.
alone the toilet, but she couldn't get him around the bathroom. So it just takes a little bit more, and each story gives you that little bit of extra education on what's needed and what can be done. That's also the real benefit of working with and in conjunction with the Villa Rancho Bernardos, because they have so many professionals in the beginning that by the time they've written up, okay, this is what the client needs, they got a full assessment ready to go already, and then we can add on to it as we see who's at care at home. But I think really the professional uh, care of getting that right away, my having my when it was my dad and he was at a facility, it was important that he got the PT. It
Mm.
really helped him. He didn't want it. He wanted to sit down and drink RC cola and watch TV. But they got him up and moving, and that was the healing point for him. So it's very solid that way.
Yeah, I agree. And Gina, you want to add to that?
Yeah, I was gonna say some, patients are stubborn, especially the elderly population, so they're not really open to our suggestions at times. But our rehab can even, take a look at pictures of the home that the family or the patient sends us, and then make recommendations.
Right. I mean, I've been to houses where the bathroom, yeah, like what Dan said, the bathroom is so small, and some sincerely they are constrained as far as cash is concerned. But then, um, I want to ask one that's very common, just like what Dan said. Some of the old folks resist; they don't want to make those changes. Based on your experience, how can a child encourage or change the mind of such parent that doesn't want to, make those um, safety changes, so to speak?
Yeah, that's definitely a tough one. Our job here, we can definitely educate, the patient as to why we recommend what we recommend. Obviously, we can't force them to do anything, but we usually get our rehab if we need to get the doctor involved here as part of that discussion, because sometimes the doctors, has a bigger influence than we do.
Right.
So we include the doctor if needed. Um, but basically it's just a conversation of safety, and we try to say if we can prevent you from not coming back to a nursing home, then that's how we explain it. But we just provide the education and the resources.
Yeah,
Okay.
that's really all you can do, even for us as well. Even though we start off at the home, we'll ask him. We had one client. We asked him, "Oh no," he says, "No, I'm going to go to bed upstairs tonight." And we're like, "No, no, no, no. You just got out, and they already had a bed that the family brought down under the living room at the first level. But he had to go. He wanted to go. He wanted to go, and at least we got him to push that back about a week and a half, and by calling in and saying, "Hey, here, this is what your therapist said. This is what your doctor said. Just take it easy," and because nobody wants to be bedridden, but it is that's the hard call. I can imagine for Gina having to sell somebody who's, "Oh no, I finished my rehab. I'm good. I could play football
Right.
today." No, no,
Right.
no. Just means that you're healthy to walk and get it done. So.
Right.
And do your patients come from all over the county, or most of them near the facility?
Mostly are near the facility, but we get from all over the county as well. So
You
sometimes
get
we'll get from like Chula Vista or Temecula, Murrieta, all the way up to Oceanside. Otherwise, generally mostly like Rancho Bernardo, Poway area, Rancho
Yeah,
Penasquitos, and a lot from Escondido and Vista, I would say.
yeah. There's a lot of population in there, anyways, right? In that whole
Yes,
area, so,
yes.
and new hospitals.
Right.
So
So we're getting closer to the time where you'll be asking some questions from the audience. So I want to quickly, I want I mean, to react to this thought, real quick. So I know that yeah, families already listening to, and of course they are beginning to understand what causes falls and what they can do to prevent falls. But um, let's I want to assume that maybe right now somebody has just fallen in this house, or somebody's about to fall. So even if there wasn't a major injury, or if there wouldn't be a major injury after a fall, but what should families do in case there is a fall, whether there's an injury as a result of that or not? What should families do hours or days after?
I would say definitely immediately let the primary care physician know. That way they can rule out any medical, issues, or they may order some lab work or ask to see the patient in the office. And then order like home health, physical therapy, occupational therapy, a nurse if needed. Obviously, if it's an injury, at the time of the fall, call 911, send them to the hospital right away. But if there is no injury and they seem to be doing okay, I would just notify the primary care physician to see if they have any recommendations.
Yeah, I agree with you. Dan, any reaction to that based on your experience?
No, just hearing what Gina said, she would go back to the doctor and find out if there was any, inside or that kind of stuff. But that
Mm-hmm.
means for every person, you got to make calls from doctor to family and try to coordinate everything together. That seems like a monumental thing to me over a period of time with 300 people coming in and going out in a few weeks, and
Mm-hmm.
it's pretty hectic, huh?
Oh yeah, and then I know that even for home health providers, if while they're on service, the patient says I fell the other day, they have to report it to the doctor
Yeah,
too, back to the primary, whoever the referring physician is. So I'm
right.
sure the physicians get bombarded a lot.
Mm-hmm.
And it's definitely depending on who your doctor is and how fast you can get services or a response, would depend on the feedback that you get.
Right.
Yeah, I agree. I mean, that 911 call definitely is important. But yes, like you said, if there's no injury, yeah, and it's okay to, just call the primary physician or whoever is assigned. Yeah.
And from
So
from our perspective, oh, sorry, from our
yeah.
perspective, sometimes the everything is smooth, right? They've spoken with you guys as far as getting the dismissal and getting the discharge, and doctors on board. And there's other times where they come home and they go, "Oh yeah, no, we didn't talk to them. We just wanted to get home." And then we're like, "Well, come on, you guys need to be part of this process."
Yeah.
Is that something you convey with them as well and talk to them about, okay, beyond where we are at the facility at Villa de Rancho Bernardo for the next 6 weeks, 8 weeks, 10 weeks? Or does that depend on what it is, right? If it's a broken ankle or if it's a heart murmur?
Yeah, so any follow-ups, as far as, you mean like doctor's appointments or home health
Yeah.
follow-ups, we set that all up before they discharge, and
Okay.
give them a written, or a printed out, post-discharge summary, so that can go with them home, and it lists everything that they need to know as far as any referrals we've made, any appointments coming up, any resources that we've referred them to, and then that packet can also be taken to any doctor's office just to show a quick summary of what happened here and what was referred to them.
Yeah. So their care is not just point to point. It's actually overlaps each other with all the different care needed.
Yes, and then
Wow.
normally like home health will also let us know if the patient went back to the hospital, or
Right.
any changes, because if somebody leaves a skilled nursing home while they're under Medicare and still has days available, they can come back here as a direct admit bypassing the hospital. If it's not an emergency situation and they're just not doing well at home, they can just come right back to the facility here without having to go to the hospital within
Okay.
30 days of discharge.
Yeah. Huh. That's good. That's a nice overlap right there.
Yes.
Yeah. So one more thing. Like I said earlier, some families are hesitant, in making those changes, safety changes, so to speak, in their home, and due to certain constraints. Yeah, Mr. Dan talked about some people being stubborn. uh, yeah, and I also say that sometimes people are unable to make those changes due to cost, and I mean the expense. So I want to know if there are some kind of community resources or kind of some support systems available to help seniors and caregivers in this kind of situation.
Sure. As far as Medicare, they cover certain items for the bathroom, like a commode would be covered, but generally, other than that, they don't cover anything for the bathroom. If you have Medi-Cal, they will cover either a raised toilet seat, a shower bench, um, and like another 3-in-1 commode. But everything else is pretty much out of pocket pay. There are some organizations that I have to look up, not off the top of my head, but there are some organizations that help with seniors who need equipment in the home as well.
Yeah, and that would be nice. I mean, that would be so nice if you could maybe after this webinar, if you would be able to provide such like the resources, the
Sure.
information, so that I can kind of we can spread it out there,
Sure.
just in case. I mean, if anyone needs that help, we have to find a way to give it to them. You know. I have a question real quick here. It says, my mom has not fallen yet, but she seems slower and less steady lately. How do I know when I should start making safety changes at home? Did you get the question?
Yes, I would say
Yeah.
based on that, the answer would be now. And make sure she has the correct durable medical equipment, whether she needs a walker or a wheelchair or any environmental changes in the home.
Right. Jan, do you have any addition to that?
No, just the last little piece is just get what's needed,
Mm-hmm.
uh, especially grab bars and things like that. Just things that they could, not just stay up. That's all. It's pretty hard when at least I've seen it out of my family, especially. But people they'll fall at any different time. You just don't know. Next thing you know, you go in and dad's on the floor. Dad, what are you doing? Oh, I just nothing. I'm fine. It's
Mm-hmm.
so you take that by what it is, but the sooner the better to get those small tools like grab bars and commodes makes a huge difference.
Right. Right. Thanks so much for that. So, another question is that I live in another city and worry about my parent falling at home alone. So, what are the most important things I can do from a distance?
I
Did
know
it?
some family members who, live out of state will install cameras in the home. That way, there's just another level of, surveillance there. Because unfortunately, we see sometimes people are on the floor for days and then go to the hospital. Um, I would say that's probably a big one if feasible. And then also just connecting them with their doctor to see if they can recommend any, home health in the
Mm,
home. Yeah, I would say that would be my recommendations.
Mhm.
right. So these last two questions are kind of, very, I would say they are hard for me, but I think we actually, I need comprehensive input from you and Dan on this one. So it goes that we cannot afford major home renovations right now. What are the most important low cost changes we should make first? That is one question. And you want to answer that first before I go to the last one?
I would say based on our experience, the bathroom is the biggest factor. So grab bars in the bathroom, and then either a shower chair or a shower bench.
Yeah, but are those really low costs?
So Medicare, yes. So grab bars aren't that much. You can get, I know our rehab recommends like Costco, not Costco, Home Depot, Lowe's. They
Right,
have grab bars available, or even Amazon.
right.
And then Medicare will cover a 3-in-1 commode, so you can use that as a shower chair if it's a walk-in shower.
Right.
For a shower bench, Medi-Cal covers that if you have Medi-Cal, but if not, I would say it's relatively like around $50 or so.
Mm. Well, I didn't know they were that cheap.
Mhm.
Oh, okay. What about the throw rugs and the likes? Are those also categorized as low cost?
Well, we would just be removing them from the home,
Oh, okay.
from any
Okay.
floor surface.
I got it. Yeah. Stan, any reaction to that?
No, I just think a lot of people forget about the little mats going into the bathrooms and showers and stuff like that. And It is like Gina's mentioned it 2, 3 times and getting those out. And that's so
Right.
true. Yeah, they're pretty slippery and if you're not under control.
Right. And the last one, which I said is kind of hard, is the question of how do I bring up fall prevention with a parent who gets upset anytime I suggest they need help. Before you react to that, I remember if a friend of mine talking to me about his dad and I was just recently diagnosed with dementia, and it's really, I mean, it's going downward spiral really fast. And the he tried talking to the mom, I mean to the wife, to his dad's wife about getting help, but she refuses. I mean, and even though it's taking a toll on her, she doesn't think that she needs you know help at home with her husband. So I kind of understand that definitely there are times that some folks will get really mad or get upset when someone, maybe a member of their family, suggests to them that they need help. So how how can such kids bring up that kind of fall prevention plan to their parents when they know that they always get angry at every time they bring up such suggestion?
Once again, that's definitely a tough conversation to have. But I think you have to be very frank with them and let them know, you want them to have their independence as long as they're able to or remain in the home. But there are some concerns due to, you can give reasons that they've had hospitalizations, they've had falls, or, whatever medical conditions that they have. And, I would say just emphasize we want you to be as independent as possible and safe in the home. So these are the measure that's recommended by, either your doctor or other healthcare professionals. And so try and emphasize that to them to see if they'll, at least be open. I know a lot of, elderly don't like people in their homes. They don't like, that just that degree of sort of interruption in their life. And so
Mm-hmm.
I think we just have to try and explain to them as calmly as possible, but also that you're concerned.
All right, Mr. Dan. So how did you get your dad, to accept the physical therapy?
We just we forced him to go. That's all. He
Oh,
he knew it got better, and he says, well, this is how. And then he started to tell us how his therapy should go, and we go, no, 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 no. You talk to the therapist, the people that are, and then your doctor, and figure it out. So we just kind of had to kind of take it over, and after a short period of time, he was all in. He realized he couldn't do it, and so I think that's part of it. The first time in is probably the hardest,
Mhm.
and the next time you're in it, they want the help. They want to go, hey, help me deal with this. So that's
right.
a big difference.
Right. I think for me as well, I think that what I would do if I was in that kind of situation, I mean, in a situation where my parents are refusing help, what I would do is maybe just get a hold of their friend, maybe their close friend, and help. I mean, just to get, I will get their close friend to talk to them. I think that works sometimes because, for instance, my dad, when I make some suggestions to my dad, even though when I talk to Dan and and some other corporation about things, they accept. But when I tell my dad about a particular thing, he looks at me as you're a boy. I mean you're just a boy. You don't have enough experience to tell me what to do. And I said, come on. I mean, when I talk to other corporations, they listen and they do exactly what I say. So if I'm telling you this, I'm telling you from experience. I mean, from my own, I mean, from professional experience. But professional and life experience doesn't mean anything to this to us, so our parents sometimes, because they look at you with the eyes of I gave birth to you. I mean, I saw you
Sure.
when you were I saw you when you were walking around the street with shots. So there's really nothing you want to tell me that makes sense. But I think if we engage their friends or some people that they trust, this could be some community leaders, it could be the leaders of their houses of worship, those that they trust. Sometimes it works. That is based on my own personal experience. Yeah. So thanks so much, Gina and Dan, for your input. I don't know if you would like to if you will have some closing remarks before we wrap up the webinar.
I just want to say thank you for having me. It was a pleasure.
It was wonderful to have you. Appreciate your expertise because that helps us all do a better job for our family and friends. And
Mm-hmm.
thanks, TJ, for putting all this coordination of the podcast together. And it's nice to be able to talk to you guys about the things that are part of our families at one point or another.
Right. Yeah. So what I hope families are taking away from today's conversation is that falls are common, but they are preventable. Based on what Gina said, there are many things that we can put in place, to prevent
Mhm.
such falls.
Yep.
And if they do fall, then of course there are tons of help, available. Of course, small safety changes can make a very big difference. So thank you so much, Dan, and to Gina for sharing your knowledge and practical guidance with us today. And thank you to everyone who joined us. We hope this conversation has given you useful and the steps to help your folks or your friends, senior, and your parents to, in just to remain safe and more confident and more independent at home. And please, you feel free to share this conversation with your caregivers, your family members, and whoever would benefit from it. And Gina's promised to provide some resources, and as soon as we have it, we're gonna share it with everyone. And thanks, everyone, for joining in. Until next time.
Absolutely.
Take care.
Thank you, TJ. Thank you, Gina.
All right,
Take
thank
care.
you. Have a great day.